Hi everyone, this is Isaac, and you are watching the video trailer of Learning with SRINIKESH. So, today we are gonna discuss about a virus called Corona. So, today we have a coronavirus specialist with us. Her name is Carla. Hi Carla, this is Isaac, and can please give us some information about coronavirus?
Yeah, sure, Isaac. Coronavirus disease, COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people, and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is to be well informed about the COVID-19 virus, the disease it causes and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based sanitizer, and don't touching your face often. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes, so it's important that you also practice respiratory etiquette, for example, by coughing into a flexed elbow.
Yeah, sure Carla. I have a question for you. Will warm weather stop the outbreak of coronavirus?
It is not yet known whether weather and temperature affect the spread of COVID-19. Some other viruses, like those that cause the common cold and flu, spread more during cold weather months, but that does not mean it is impossible to become sick with these viruses during other months. There is much more to learn about the transmissibility, severity, and other features associated with COVID-19, and investigations are ongoing.
So will the mosquitoes or ticks spread coronavirus?
At this time, CDC has no data to suggest that this new coronavirus or other similar coronaviruses are spread by mosquitoes or ticks. The main way that COVID-19 spreads is from person to person.
So is it safe to get care for my other medical conditions during this time?
It is important to continue taking care of your health and wellness. Continue your medications, and do not change your treatment plan without talking to your healthcare provider. Continue to manage your disease the way your healthcare provider has told you. Have at least a 2-week supply of all prescription and non-prescription medications. Talk to your healthcare provider about whether your vaccinations are up to date. Call your healthcare provider if you have any concerns about your medical conditions, or if you get sick. To find out about different ways you can connect with your healthcare provider for chronic disease management or other conditions. Do not delay getting emergency care for your health problems or any health condition that requires immediate attention. If you need emergency help, call 911. Emergency departments have infection prevention plans to protect you from getting COVID-19 if you need care for your medical condition. Continue to practice everyday prevention. Wash your hands often, avoid close contact, wear a mask, cover coughs and sneezes, and clean and disinfect frequently touched surfaces often.
What cleaning products should we use to prevent from getting affected by coronavirus?
Hydrogen peroxide-based systems for cleaning, disinfecting, and storing contact lenses should be effective against the virus that causes COVID-19. For other disinfection methods, such as multi-purpose solution and ultrasonic cleaners, there is currently not enough scientific evidence to determine efficacy against the virus. Always use solution to disinfect your contact lenses in case to kill germs that may be present. Handle your lenses over a surface that has been cleaned and disinfected. Find more information about how coronavirus spreads and how to protect yourself. Visit CDC's contact lens website for more information on healthy contact lens wear and care.
What should I do if I or someone at my house gets sick?
Most people who get COVID-19 will be able to recover at home. CDC has directions for people who are recovering at home and their caregivers, including, stay home when you are sick, except to get medical care. Use a separate room and bathroom for sick household members, if possible. Wash your hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing, or sneezing, going to the bathroom, and before eating or preparing food. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty. Provide your sick household member with clean disposable face masks to wear at home, if available, to help prevent spreading COVID-19 to others. Clean the sick room and bathroom, as needed, to avoid unnecessary contact with the sick person. However, some people may need emergency medical attention. Watch for symptoms and learn when to seek emergency medical attention. When to seek emergency medical attention, look for emergency warning signs * for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face *. This list is not all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. Call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for someone who has or may have COVID-19. What is contact tracing? Contact tracing has been used for decades by state and local health departments to slow or stop the spread of infectious diseases. Contact tracing slows the spread of COVID-19 by letting people know they may have been exposed to COVID-19 and should monitor their health for signs and symptoms of COVID-19, helping people who may have been exposed to COVID-19 get steady, asking people to self-isolate if they have COVID-19 or self-quarantine if they are a close contact of someone with COVID-19. During contact tracing, the health department staff will not ask you for money, social security number, bank account information, salary information, credit card numbers.
So finally, should sidewalks, roads and other public places be disinfected to prevent coronavirus?
CDC does not recommend disinfection of sidewalks, roads, or most other outdoor spaces. Spraying disinfectant on sidewalks, roads, and other outdoor spaces is not an efficient use of disinfectant supplies and has not been proven to reduce the risk of COVID-19 to the public. The risk of spreading the virus that causes COVID-19 from these surfaces is very low, and disinfection is not effective on these surfaces.
So, thank you, Carls, for spending your precious time and clearing all our doubts on coronavirus, COVID-19.
Yeah, thank you.
So, guys, if you like this video, please press the like button and subscribe to my YouTube channel. Don't forget to share the video with your friends. And also, if you have any queries on coronavirus, please post a comment.